It was actually the first day that I noticed when JT and Linda brought this into my office. The first patient that I used it on, that would be a very difficult patient normally to actually mobilize and get movement out of his lower back without me having to just pound on him and get that thing to move. By using this, I actually got the easiest adjustment on his lower back that I've ever gotten. And it was simply just because we actually stretched and relaxed his back. And of course, he's the type of guy, that I can, pound it and yell at him all I want about drinking water and doing the stretching that's proper like he's supposed to. But, he never does. Well, the cool thing about this is he didn't have to do anything. He doesn't have to go into my rehab area and actually stretch. He can just lay down on a sofa-looking thing, which I'm sure he's good at. But he can lay down on this thing and actually get that active mechanical traction as well as stretching, and then makes the adjustment much easier. Now, obviously, if he adjusts easier, then he's going to be more compliant as a patient, as well as if I can actually decompress that spine and stretch those muscles, his adjustment will last longer, so that makes me better than the guy down the road that doesn't have this. Now, the next portion, in about 10 to 15 seconds, we're going to see this thing actually stretch out, and that's that actual traction, or that true mechanical traction that we get. Now, instead of using all of the harnesses, what they're doing with this one, which once again was very intelligent, is they use these to hold the patient in place. The first time, and I'm going to stop it again, the first time that I saw this, I worried that this was going to be very irritating, especially to maybe some of the ladies that have excess tissue in that area. However, we didn't have an issue with that. I haven't had a problem with any male or female with this, because these are very, as far as the tissue itself is very soft. It's like a memory foam. So it serves the purpose of what we need, and we haven't had any complaints with it, which is really nice. But what we do here, whenever this thing actually travels out, that's when we're getting that true decompression on those discs down there through the mechanical traction aspect of it. Now, one thing that I found with this one, and I actually asked JT if this was a problem that he had whenever he was coming up with this, is a condition that we all know, that we've all used, we all learned in school and had a hard time spelling that stupid thing, was spondylolisthesis, which is where one of the bones of the lower back has slid forward on the other bones, and you actually put a tremendous amount of pressure on the spinal cord itself, as well as the joints in the spine, and typically you'll even get some of those posterior elements to actually fracture. It's a chronic low back issue, and there's really nothing that can be done in severe situations. A grade 3, grade 4, they'll actually do surgery, but for all the others, us chiropractors get them, and PTs get them as well. What we want to look for with this device, and what I found that was so awesome, is of course by those legs wrapping over the top and it rotating that pelvis backward. As you get that posterior rotation of the pelvis, obviously you're shifting that sacrum back, which takes that pressure off of that anterior listhesis. So the great thing that we get then is, as we decompress, not only are we decompressing that discal area, but we're also taking additional pressure off of those nerves that come from that obviously go down our legs, and we get those L5 radiculitis. Now, I actually have a patient that has spondylolisthesis that's actually being treated with this, and we've had really great success, and he's had chiropractic treatments in the past, but in combination with the chiropractic treatments along with this device, he no longer has any leg issues anymore, and on a day-to-day basis, as long as he's doing his basic stretching at the house and coming in for his maintenance adjustments, he no longer has low back pain. And when you're talking a grade 2 spondylolisthesis, to say he has no low back pain, as all of you know, that's just ridiculous. It just doesn't happen. So that's just one of the other ways that this table really showed me a major improvement on how this thing can make my practice go above and beyond, and I can treat my patients so much better.